Hello friends, today is Monday, March 25th, and I'm getting ready to head out to my post-op follow-up for my tissue expander insertion surgery and to see if I can get any drains removed. I'm bringing with me this little, hold on, not little, but a piece of paper that shows, it's a log of all of the times that I've drained milked my drains, the JP drains, since I got them in. They have been only really putting out anywhere between 20 and 30 mLs for the whole day. So I'm hoping that they can both come out today. If they don't both come out, I could see why the right side might stay in. That's the side that had the cancer and the lymph node involvement, way more trauma than the left. That one is still putting out like pinkish reddish color. It hasn't switched over to apple juice yet. The left side is like pinkish apple juice. So we'll see what they say, but maybe I'll get both out. Who knows? I will let you know. So I'm gonna get going and I will see you in the next clip. So I'm in the room, got my giant gown on. It's like a blanket. We're gonna do a room tour real quick, super quick, because I think she's gonna come in like any second. Room tour, room tour. Well, that's pretty. Room tour, room tour. And that's where I'm gonna sit. And I wanted to show you my drain is only putting out that much, which is like nothing. So we'll see what happens. Oh, and the other one, hold on, is only putting out like, try not to show my skin because I don't want YouTube to flag it, but look, that much. So hopefully it's time for them to come out. All right, I will let you know how it goes and I'll see you in the next clip. I got my drains out. I was not expecting both to come out, but that's cool. I'm excited. Yay! I can like be free to drive and I don't have to worry about my Christmas ornaments dangling off of me and getting caught and everything. Also, I can't shower for 24 hours, just like last time, because of the open wound. It's so crazy when she pulls the drains out. I'm watching it and I'm just like, can't feel it. Like, how is there this huge, like giant, huge Alfredo noodle spaghetti thing in my body, plastic tube, and I don't feel it coming out? Like, how do you not feel like going and hooking right out of your boob? Crazy. Like, I know I'm numb in some spots because of the nerve endings being severed, but I can feel like, I'd say at least like almost 2/3 of my breasts, and I just didn't feel that going out at all. It's so bizarre. Craziness. But I also wanted to let you know I have to go back next week for a follow-up here. I have 3 appointments next week. Monday is my breast surgeon follow-up post-op, 1 month. Oh my God, sorry, that was a bee and I thought it was inside and it's not. Hello, spring. All the bees and all the demon bugs are coming out again. It's the one thing I don't like about warm weather is the bugs. Anyway, I'm getting sidetracked. So Monday is my breast surgeon follow-up, 1 month post-op follow-up. Wednesday in the morning is my oncologist follow-up. I see another bee, sorry. And that, I'm not sure. I think we're going to probably talk about radiation and maybe like my CT and bone scan. Who knows? Well, I'll take you with me for that too. And then I just made an appointment today for a week follow-up from today's visit, same day as the oncology visit, Wednesday, April 3rd, to check for any seromas, where the drains just came out in case there's any like fluid buildup, and to also fill my expanders. They only have 60 cc's right now, which isn't really that much. So she said the most that they can expand before radiation is 150. So she's like, if anything, I'll just do 1 fill, so you're at least at 150 cc's, which again isn't really that much. And then do all my radiation, and then continue filling weekly after that. So that's the latest and greatest for today. I'm gonna get going. I have a couple errands to run, and then I'm gonna head back home with my baby. And she's a little sick right now, so I've been taking care of her too. It just never ends. She has an ear infection and pink eye. So I am gonna get going. I will see you in the next clip. Hello friends, and good morning. Today is Monday, April 1st, also April Fool's Day. It is pouring rain, and I'm getting ready to go now to my first of 3 doctor appointments that I have this week, all follow-up appointments. Today's appointment is with the breast surgeon. That is the doctor and surgeon who removed my breast and tissue and all of the cancer and the lymph nodes. All of the cancer, and then all of my lymph nodes as well. So, not really sure what we're going to talk about today. Probably the results of the CT and bone scan. I am going to ask about if he can put through a request for a PET scan. We'll see if that will even work. And I have a couple other questions, like random ones, like just about post-surgical things and limitations and all that, which I could technically also ask my plastic surgeon. So we'll see what he says. But I'm going to get going and drive safely because it's raining. So I will see you in the next clip. For my surgeon to come in and do a follow-up. I'm gonna give you a room tour because you already know the drill. I do this every time I'm in a doctor's office. Room tour. Today's picture is a bunch of rocks. Okay, and here's the room tour, and that's where I'll be sitting. So I have a couple questions I'm going to ask, and then I will fill you in on the answers and let you know how it went. All right, see you in the next clip. Oh my Lord, friends. When I say it has been a busy week, it has been a busy week. I completely forgot to check in after my doctor appointment yesterday. Today's Tuesday, by the way, April 2nd. I am completely checked out. I am at my max. To put it into perspective, my daughter's on spring break this week, so I'm getting not one single moment nor thought to myself. The only reason I'm having one right now is because I snuck out into the sunroom, so expect an interruption any second. Also, we were all sick for Easter, the Easter holiday in general. It was a nice day. We were all congested, and my daughter was sick the week prior. She had an ear infection and pink eye. And then I still kind of sound a little nasally, but I think mine's allergies because I don't have a fever or anything. And I finally got my sense of smell and taste back, but on Easter I had no sense of smell or taste. That was so boring. I'm like, why even eat? Like, when you can't taste anything, it's like, what's the point? Anyway, today has been a nonstop day through no fault of anybody's. It's just everything's happening all at once. And it was pouring rain all day, and I had to run a whole bunch of errands out in the rain with a 4-year-old today. So we were completely soaked, like soaked, even with an umbrella, because it was that like sideways rain where like if you gotta like angle the umbrella like this to shield the rain instead of above. And then I'm like holding shopping bags, holding her hand like through the parking lot and telling her she's holding her hood. We were just soaked. It was a mess. But I mean, I had to grocery shop and I had to get stuff done and run errands. And now I'm home making dinner, which is going to be a delicious dinner because I can smell it right now. I'm making baked chicken thighs with a huge side salad with green peppers and tomatoes on it. And it's romaine lettuce. And then I'm also baking my favorite asparagus that I bake with the, what is it? Locatelli cheese. I always want to call it ricotta. It's not. It's like shaky cheese. I do Locatelli cheese with a little bit of like an original blend, Mrs. Dash, which just smells so good in the house when it's cooking. There's no salt in that, and I like salt. So when it's all done cooking, I just add my own Himalayan salt to it. But anyway, while I have 2 seconds to myself, or maybe what are we up to, 2 minutes right now, I wanted to check in from yesterday's appointment with my breast surgeon, just let you know how it went. And from what I can remember, because now we're over 24 hours later and my brain has the memory of a flea. So everything went really well overall. He's very pleased with how I'm healing and my range of motion and how I can get my arms up and I'll be all ready for radiation. He also put an order in for radiation, and yesterday afternoon, as he said I would, I got a phone call to plan my radiation appointment. It's radiation planning, and I forget the other word, but that's when they do the chest CT scan and they put the tattoos on the area so the machine knows where to line up and do radiation daily for the next 6 weeks. So that appointment is this Friday. I have an appointment bright and early tomorrow morning with my oncologist as a follow-up. And I also, right after I see her, I go to another doctor appointment to get my first fill in my tissue expanders before radiation begins, because you can't fill at all during radiation. You have to wait until after to expand. But you can be expanded up to 150 cc's before radiation, and I am only at 60. So I will be an entire A cup. I guess I'll just update you tomorrow with how everything goes. And oh yeah, the breast surgeon, sorry, my brain is that of a flea. So the breast surgeon was pleased with my healing. He's very pleased with my CT and bone scan results, which is good. It shows no signs of cancer. And I asked about getting a PET scan and would insurance deny it, and he said yeah, they're probably going to deny it because everything came back clear on the CT and bone. He did say the reason why a PET scan was ordered first is because it's easier. It's just one image instead of having to do the CT with contrast and then a bone scan and having to get an IV and all that stuff, like how I did 2 weeks ago for the CT and bone scan. So it's not that it shows so much more cancer if cancer is present. It's just easier to have done. Like, it's easier for the patient. So that's good to know. Basically, the CT scan and the bone scan is enough to confirm that there's nothing metastasized in my body. And I asked too, wouldn't the PET scan see if it traveled to the brain? Not that I think it did, but like, you never know. And he said it doesn't check the brain. I mean, the brain will show on the PET scan, but it lights up so much up there from the dye that you wouldn't really be able to tell anyway from a PET scan unless there was a tumor or a lesion. You wouldn't be able to tell if there was like cells floating through my body because they're so tiny. And I remember someone in the YouTube comments of my last video did say the same thing, that like a PET scan doesn't show metabolic, I think either metabolic or thermal. I forget what the comment was. But yeah, he confirmed that too. Oh, and he also still agrees I should get the physical therapy and just keep an eye out for lymphedema, because I do not have lymphedema right now. I probably wouldn't even get it if I didn't have to do radiation, but apparently radiation can cause lymphedema. Happy, happy, joy, joy. So it's good that I'll be in physical therapy for that and at least getting massages until I start to burn, I guess, which I'm assuming would be like week 4, like week 3 or 4. I'm not really sure, but Everything went really well yesterday. It was a nice visit. I love my breast surgeon. He's cool. He's very intelligent, and he did everything that he could do to get all the cancer out of my body. I completely trust him 100% with my life. So I have my oncologist appointment tomorrow. I'm assuming to discuss maybe like radiation and the CT and bone scan a little bit further, or just revisit it with her and get her standpoint on it. Also to discuss when the targeted therapy, chemotherapy drug will begin. That's an oral pill I will be taking every day for 2 years. Also probably to discuss when the oral hormone pill that I'll be taking every day, when that will begin. I believe she said both of those won't start until after radiation, but I am getting the Zoladex monthly hormone injection during radiation. I already had one last month, and I get another one this month on, I think, the 9th. So next week, I'll be getting another injection in my gut. So that's pretty much the update for now. I'm just going to check in tomorrow morning with you and let you know how that appointment goes and how my fill went, and then what's happening after. Oh, back to the breast surgeon real quick. I don't see him again until July. And then after that, based on how everything's looking in July, it's just an exam to check for lumps and bumps and see if anything's going on or any changes, which he doesn't expect any to happen. After that, it will either be every 6 months that I see him or every 12, so like once a year, because I will be seeing my oncologist every 3 months for the next 5 years because I'm on medicine. So, and also just to be examined. But because and since my mouth can't catch up with my brain. Just imagine what my brain sounds like. Since I had a double mastectomy bilateral, I don't need mammograms because there's nothing there. So all that I will be receiving is physical exams, like checking for lumps and bumps. So yeah, that's one of the perks to not having boobs is you don't have to get mammograms every year because there's no breast tissue there. So nothing to really check. So, all right. I think that's pretty much it for now from what I can recall. I need to go check on my dinner that is baking in the oven. So I will check in with you tomorrow, and I will see you in the next clip. Good morning, friends. It is April 3rd, Wednesday, and it is pouring rain again. So, and I'm actually running late to my appointment. So I'm going to just head on out, and I will check in with you when I get there. See you in the next clip. Okay, I'm in the room, and look, I got a pink one this time. So cute, and it matches my bracelet. Anyway, we're gonna do a quick room tour because if you know, you know, you know. Rooms are looking at the beach. How pretty! It's a room tour. That's where I'll be sitting. Room tour, and that's it. So I'm gonna meet with my oncologist, and I'll let you know how it goes when I'm all done. See you in the next clip. All right, so it's pouring. That went really well. Long story short, I will be beginning my, hold on, somebody's walking by and probably thinks I'm recording them. Definitely not. Sorry. I know, it's so awkward. Here comes another person. What is going on? Anyway, so I will be beginning my Arimidex oral hormone pill, probably next week. So yay, get ready for the turning up the heat because you can get hot flashes from that. Hopefully I don't, but you never know. I'm a hot butt, so hold on, let me just get a little swig of my coffee. Yowza, that is really hot. And this is my Nightmare Before Christmas mug that I talked, or tumbler, that I talked about a couple videos ago. I think I linked it in the video too. This tumbler keeps your coffee smoking hot. I didn't even realize that until today. But anyway, I'm getting ready to go to the plastic surgeon to get my last fill before I begin radiation. today's appointment went well, and I will be beginning that hormone pill next week after I get my second injection of Zoladex. And then I also have to get blood work done before I see my oncologist in 6 weeks, because she wants to just get a check on like how my hormone levels are doing, just to make sure that the pill's doing what it's supposed to be doing and the injection is doing what it's supposed to be doing, which is decreasing your estrogen and putting your ovaries to sleep for a little while, aka clinical menopause. And then I don't begin the targeted therapy medication until radiation is done. Oh, she also wants to get, probably at my next visit in 6 weeks, she will request a bone density scan just to check, because one of the side effects of the Arimidex, I believe, is bone thinning. So just to avoid osteopenia or osteoporosis, we want to get a baseline of what it looks like now, because she also said chemotherapy can cause bone thinning as well. So just to get like a baseline of how my bones are looking right now, and then check, just keep an eye on it. I think she said once a year, either once a year or every 6 months, I forget, but just to keep checking it and making sure I'm not experiencing any of that. And if I am, there is a bone support, a bone something. There's some type of a something that I could take that helps with not having bone thinning. I am not a doctor or a nurse, so I apologize if I sound completely uneducated right now. I did not study this stuff, and I am completely dumbing it down because I'm dumb when it comes to that. All right, I'm gonna get going to my next appointment, and I'll see you in the next clip. Okay, I'm at appointment number 2, numero dos, and we're gonna do a room tour because that's what I do. Let's go. Room tour, super quick, because this is the plastic surgeon where I will be, it's a follow-up to see if there's any seromas from having my drains pulled last week, and then a partial fill. So I will let you know how it goes, and I'll see you in the next clip. All right, so I got a fill and drained my seromas. I'll tell you more about it in the car. See you in the next clip. Okay, so they drained my seroma, which I didn't even know I had. I ended up having 70 cc's of it in my left, which is not even the most traumatic side of my body. And then I had 45 cc's of a seroma in the right, which is crazy because I remember in my CT scan that I got 2 weeks ago, had, like, they saw a seroma on there, post-surgical seroma from the bilateral mastectomy that I had, and like the drains being pulled from that. Now normally, like, your body will just slowly over time like take away the fluid. I don't know how to word it. It'll dissolve, I guess, into your body, but this was a lot, and I don't even know, like, you don't even know it's there, but they said that's not even like that much. Like 70, it sounds like a lot, but 70 isn't really that much, because if you think about it, after surgery, in a day, I was making like anywhere between like 50 and 100 cc's per day. So this was like a week. When did I see her? A week and 2 days worth of fluid buildup, which isn't that much per day if you think about it. So I have to go back next week just to check for any more seromas, and if there are any, to drain them. So that's exciting. It's so weird. I never like thought I needed that, but you never know. Also, she filled me 60 more cc's into my expanders. So now my expanders have 120 in there. So it's just a little itty bitty A cup-ish, a little bit smaller than an A cup. So, and that's it now till radiation's done. And you have to wait a month after you're done radiation to begin expanding or filling again. So probably like mid-July is when I'll start to re-expand my chest. All right, it is pouring rain, like pouring all day, torrential Amazon rainforest level of rain today. So I'm gonna head home and get home to my baby, and I will see you in the next clip.
I just have to tell you too real quick while I'm thinking about it. When I was having my seromas drained, I was like, my seroma. And I was making the nurse and the doctor laugh. Oh my God, I'm a goofball. I just had to share that with you. So, okay, bye. I am back in the car again. It is still Wednesday, April 3rd, but I had to run some errands and now I'm home. I don't know why I run errands in the rain. Like, hello, couldn't pick a better day, right? But anyway, I just wanted to throw this into this video real quick because it's been on my mind and I keep forgetting to add this little snippet of info or request, I guess, from you guys in my videos. So I'm thinking about maybe doing a Q&A video. I wanted to know your thoughts on it. And if you have any questions that you would like answered in the Q&A, put them down in the comments below and I'll pick like 10 or 15 of them and just make a whole video answering your questions, whether they're like personal or just about cancer or chemo or surgery or any of those things that you would like to know that I haven't covered in any of my videos. Or even if it's just about like test results, like maybe I forgot a part of one of the test results and I said I would talk about it, anything that you can think of. So if you have any questions for me that you would like answered, or just maybe even like opinions, if you're getting ready to start your breast cancer journey, or if you know someone who's getting ready to start their journey and they have questions, just plop it down below in the comments. I'm gonna do a video of answering, we'll say like around 10 to 15 of them, depending how long or short my answers are with the questions. All right, so I hope that interests you, and if it does, let me know below in the comments if it's something you would like me to do for future videos as well. All right, I will see you in the next clip. Hello friends, it is Friday, April 5th, and I'm getting ready to go now to my radiation planning and mapping appointment where they put little tattoo dots on my area. So I'll let you know how that goes. Also, totally not cancer journey related, we had an earthquake today. I'm in New Jersey, so it was up in North Jersey, the earthquake, and it was really weird. It felt like there was like a jackhammer shaking the house. Some people felt it, some didn't. I for sure did. And yeah, that was pretty interesting. So I hope everyone's okay. I hope it didn't really like cause too much damage, but that was weird. Anyway, I'm gonna get going to my appointment and then I will let you know how it goes and what the plan is for radiation. And then I will probably close this video out so I can get it up and update all of you, because it's been like a week and a couple days since I put a video out. And I know some of you are asking if I'm okay and all that. So, all right, I will see you in the next clip. I just met with the nurse to talk about radiation and what to expect, and now I'm getting ready to go get my CT scan. So, quick room tour. And then I'm gonna have to go because they're gonna come in and get me and get my CT scan, but I'll fill you in from the car. See you in the next clip. All right, so I'm all done. That was interesting. So I got like a huge folder, not a huge folder, a standard size folder, but it's packed with information about radiation. And in a nutshell, I just have to make sure I keep an eye out for lymphedema, make sure I keep an eye on my skin, and any redness. I'm allowed to put a thin layer of Aquaphor on it every single day after radiation. It needs to be kind of dry before radiation. I want to see if I can show you. I got marked. Here, I'm gonna bring you down. See that? There's a little tattoo dot, I think, somewhere on there. I don't know. Anyway, there's one there, and then there's one over here on the side, and then there's one on this side. And I asked, are you radiating my left side? Because my right side's where the cancer was. And she said, no, it's just to line up the machine properly to make sure we have you in the exact same position so we can radiate the exact spot every day. So the last thing in these notes that I'm reading is to wear loose clothing or like non-restricting clothing, and avoid tight clothing, avoid underwire bras. But I will say, I'm not getting any more fills as far as I'm aware, like before radiation starts. Definitely no fills during radiation. So I don't even need a bra anyway. I haven't been wearing a bra for like ever since my mastectomy, my bilateral mastectomy. Yeah. So I begin radiation on April 22nd. And I will be going every single day for the following 6 weeks. So I plan to take you with me every single day so you can see what it's like. And I'll give you literally a daily update of what my skin looks like, how I feel, and what it feels like. Because it is pretty numb over there. So even if it would have been painful or would have been itchy, I don't feel anything. So we'll see. I'll keep you posted on that. So that's pretty much the update for radiation. And I think I'm going to close this video out here so I can get it up and update you and let you know what's going on in the wonderful world of a fairy's cancer journey, Brie, and my life and my cancer journey as it continues on. So I hope you are having a lovely week. If you are starting your radiation journey, we can hold hands and walk through this together. And I hope you are doing well. Or if you just had your mastectomy surgery or a lumpectomy or a bilateral mastectomy, with or without tissue expanders, whatever part of your journey you are on, I hope you are doing well. And I love you, and I love all of your comments and your support and sharing your stories with me. I'm glad that I am encouraging you to stay positive and stay strong and just focus on today. Just focus on one thing at a time, as usual. It's what I always say, because really, tomorrow is not promised. And you might be having a bad day today, but it's going to be better tomorrow. So just focus on today, do your best, try to find one positive thing in your day. If you're having a yucky day today, there's got to be one good thing that happened, and try to focus on that, because it really does help raise your vibration. Even if it's just putting on your favorite song and dancing like a complete idiot in your kitchen to raise your vibration. What? Am I calling myself out on that? Do I do that? No, I do that literally like every day. I swear to God. It's one of my fun goofball things. Plus, it helps with my range of motion. I literally work out like I'm watching. I'm not working out, but like my dance moves are horrible. My dance moves are, I will put on any song, and any song. It doesn't matter. It could be Salt and Pepper. It could be Aerosmith or Guns N' Roses. It doesn't matter what it is. I'm literally doing like a 1980s workout, trying to get my range of motion back, and, you know, just being a goofball, because it makes me laugh. And like, if you can't laugh at yourself, well, then what's the fun in that? You know, like, what's the fun in life if you can't laugh? Laughter is the best medicine, even if you're laughing at yourself. So that being said, I hope you're having a good day. Don't forget to laugh at yourself, because life isn't that serious. I mean, it can be to you, but to me, it's not that serious. We're here to have a good time and love each other and just get through today, because that's all we have. So make today as good as it can be for you. So I hope this video helped you in some way. As always, I hope all of my videos help you in some way, shape, or form. Or if it's not you, it's someone that you love and care about who's going through a similar journey as mine. I hope this video helps them, or helps you help them in some way. And I want to remind you to please subscribe to my channel, because I will be putting videos up still every week, if not multiple times a week, or sometimes every other week, depending on the content I'm coming up with and what I'm able to edit and get out timely. So yes, I hope you are having a great week and a great day, and I better see you in the next one. Bye.